Little girl's rare condition sees her eat walls and TV remote as mum begs for help.
Boy who had about 500 epileptic fits a month now seizure-free due to medical cannabis.
Having less than recommended amounts of caffeine while pregnant could still impact your child's life, new study.
Malaria mosquito from Asia spreading to Africa.
Woman in coma for 7 months gives birth to healthy baby and is still unconscious.
Woman dragged to quarantine camp by hazmat-suited officials in China's zero-COVID regime.
Mum of 9, 29, spends £1,300 on food every month, and she's expecting baby number 10.
New antibiotic appears to be effective against urinary tract infections, drug company says.
Research could help predict diseases in men.
Dancing Kenyan nurse goes viral for cheering up child.
Hospital waiting lists in England hit record highs.
More than 3 million US middle and high school students reported using tobacco in 2022.
Mindfulness works just as well as medication to curb anxiety, study finds.
Experimental therapy gantenerumab fails to slow or improve Alzheimer's memory loss in clinical trials.
Sperm count declining worldwide, study.
Leprosy bacteria able to regenerate organs, study.
WHO recommends skin-to-skin care for preterm babies.
Game-changing type 1 diabetes drug approved in US.
Over 1 billion youth risk hearing loss from headphones, loud music, study.
Arsenal and England's Bukayo Saka pays for 120 children to have life-changing operations.
Poor nutrition can cause physical, mental decline in elderly, nutritionists.
Parents welcome twins from embryos frozen 30 years ago.
Bride stung by one of world's most venomous fish on honeymoon from hell.
779 million Africans lack sanitation services, WHO.
Baby given 1 day to live reaches first birthday.
Girl, 7, hailed a hero after diving into pool to rescue toddler from drowning.
Pregnancy soon after miscarriage, no more risky, study.
8 glasses of water a day may be too much.
Little girl's rare condition sees her eat walls and TV remote as mum begs for help. A mother has been left pleading for assistance after learning that her young daughter has a rare condition that causes her to eat everything in the house, including the TV remote, walls, and furniture. Dolly, who is 2 years old, must be constantly watched by her exhausted mum, Jordana Tate, 25, in order to prevent her from ingesting potentially harmful items from their home. Pediatricians have a suspicion that the child is autistic and has pica, an unusual eating disorder that causes cravings for inedible objects. Dolly is said to be a bubbly and cheerful child, but due to her condition, her mother is compelled to keep things out of Dolly's reach around the house in case she finds them and eats them. Jordana, who left her job as a sales account manager to care for Dolly at home, claims that the lack of support for the condition her daughter is dealing with has left her feeling frustrated. Dolly is currently under the care of a pediatrician, but she has been waiting a year to see a child psychologist.
Boy who had about 500 epileptic fits a month now seizure-free due to medical cannabis. A boy who once experienced 500 potentially fatal fits per month will mark his 1000th seizure-free day with medical marijuana. Only 3 people in the UK, including Alfie Dingley, who has severe epilepsy, have received an NHS prescription for the medication. Hannah Deacon, the child's mother, claims that since cannabis was made legal for medicinal use on November 1, 2018, it has significantly improved the 11-year-old's quality of life. Thousands of people, however, are still unable to access funded prescriptions, forcing their families to pay thousands of pounds each month to go private or purchase the medication illegally. In accordance with recommendations from the National Institute for Health and Care Excellence, doctors may recommend medical marijuana if the available data support its potential benefits. Even so, the British Paediatric and Neurology Association opposes the use of whole plant medicinal cannabis, which contains the psychoactive compound THC, claiming that the companies making the products have not carried out the necessary clinical trials to demonstrate their safety.
Having less than recommended amounts of caffeine while pregnant could still impact your child's life, new study. According to a recent study, drinking a hot cup of caffeinated coffee or tea in the morning may sound divine to some, but it may be harmful to the unborn children of pregnant women. The study, which was released on Monday in JAMA Network Open, found that children who were exposed to small amounts of caffeine before birth were generally shorter than those of mothers who did not consume caffeine while they were pregnant. Currently, the American College of Obstetricians and Gynecologists advises keeping caffeine intake during pregnancy to under 200 milligrams per day. According to the Cleveland Clinic, a cup of caffeinated tea typically contains about 75 milligrams of caffeine. A cup of instant coffee contains about 100 milligrams, and a cup of filtered coffee contains about 140 milligrams. The caffeine content of chocolate is 31 milligrams. But according to Glisson, a research fellow at the Eunice Kennedy Shriver National Institute of Child Health and Human Development, the differences discovered in the most recent study were found even in the children born to parents who consumed well below the current recommendations, less than half a cup of coffee per day, during pregnancy.
Malaria mosquito from Asia spreading to Africa. A malaria-carrying invasive species of mosquito from Asia, according to scientists, has made its way to Africa, where it poses a particular threat to urban dwellers. The majority of malaria deaths worldwide occur in Africa, where the disease is primarily spread by a mosquito that is only found in rural areas. However, the Anopheles stephensi mosquito species, which is to blame for the majority of cases seen in Indian and Iranian cities, breeds in urban water supplies and is immune to the majority of insecticides that are currently in use. The mosquito has already contributed to an increase in cases in Djibouti and Ethiopia, seriously complicating efforts to halt the spread of the disease. According to researchers, if it spreads widely in Africa, nearly 130 million people could be at risk.
Woman in coma for 7 months gives birth to healthy baby and is still unconscious. A healthy baby girl was born to a woman who had been in a coma for 7 months. Only 40 days after becoming pregnant, the new mother from Uttar Pradesh in northern India suffered serious injuries when she fell off a motorcycle without a helmet. The mother, Shafia, was allegedly riding the bike with her partner when her burqa became tangled in the back wheel. She has undergone 5 different brain surgeries at the All India Institute of Medical Sciences, AIIMS, hospital in Bulandshahr since then while she has been in a coma. She underwent surgery to remove a portion of her skull while she was unconscious in order to relieve pressure on her brain. The 23-year-old was consequently forced to rely on a ventilator to maintain breathing. Doctors struggled with the difficult choice of whether to end the pregnancy throughout the entire process. However, an ultrasound revealed that the pregnancy was normal, and they ultimately advised her family to keep the pregnancy going. Despite doctors' predictions that the mother had only a 10% to 15% chance of waking up, she gave birth to a healthy baby girl on October 22. Shafia was taken off the ventilator after giving birth, and she now occasionally moves her head and legs. Her family is still holding out hope that she will one day meet her daughter.
Woman dragged to quarantine camp by hazmat-suited officials in China's zero-COVID regime. This is the horrifying moment that officials wearing hazmat suits forcibly dragged people to COVID-19 quarantine camps in China. The upsetting video, which appears to have been shot last month, shows 2 officials dragging a woman along the floor. Another person is seen lying on the ground surrounded by hazmat suits in the same video clip as 3 people carrying another person. The disturbing video comes to an end with terrified screams and shrieks.
Mum of 9, 29, spends £1,300 on food every month, and she's expecting baby number 10. A mother of 9 children spends more than £1,300 a month feeding her large family. However, her food budget will increase even further in January as she's now expecting her 10th child. When Amanda Sellers, 29, and Chris, 33, began dating in January 2013, she persuaded him to have as many children as possible because she had always wanted a large family. Even though Chris was hesitant because he already had 2 children from a previous relationship, Logan, 12, and Ryan, 11, the couple became engaged in May of that year and began trying for their first child just 2 months later. But soon Liam, now 8, arrived, and then Maya and Mia, both 7, Bryson and Asher, both 5, Eli, 3, and Emma, 2, came along. The family uses a 15-seater transit van to transport everyone and homeschools their kids. Amanda plans all of their meals for a month and does one big grocery shop to manage their large family. The stay-at-home mum teaches the kids to be independent as soon as they are old enough to help with the chores.
New antibiotic appears to be effective against urinary tract infections, drug company says. The first new type of antibiotic developed in more than 20 years to treat urinary tract infections, UTIs, appears to be so effective that the pharmaceutical company stopped testing and will soon submit its data to the U.S. Food and Drug Administration for approval. The new antibiotic gepotidacin, according to the pharmaceutical company GSK, performs at least as well as nitrofurantoin, the primary treatment for UTIs right now. The company declared that it would abide by the advice of its independent data monitoring committee to terminate the study early, because the drug had already demonstrated its efficacy. Next year, GSK said, it will submit its data to the FDA for approval and prepare its findings for publication in a medical journal. On the website clinicaltrials.government, the study's expected completion date is listed as being about a year away.
Research could help predict diseases in men. A hormone has been identified by researchers that may be able to predict whether men will eventually develop specific diseases. INSL3, which develops in males during puberty, has been the subject of research by specialists at the University of Nottingham. They think it provides an early indicator for predicting age-related disease, giving doctors the opportunity to treat patients before they get sick. The results are based on examinations of blood samples from about 3,000 men in Europe. The study demonstrates that the same testicular cells that produce testosterone also produce INSL3, but INSL3 is stable throughout a man's life, unlike testosterone. According to the university, this made it a distinct and trustworthy method of disease prediction. The researchers found that blood levels of INSL3 were associated with age-related illnesses like bone weakness, sexual dysfunction, diabetes, and heart disease. They hoped that the discovery would enable quick medical intervention to attempt to prevent them.
Dancing Kenyan nurse goes viral for cheering up child. A Kenyan nursing student, who was seen dancing to the upbeat tune of Baby Shark children's song to cheer up a hospitalized child, has received praise. In the video, the youngster cheerfully nods and imitates the nurse. The pediatric nurse has been identified as Elizabeth Robai Lukalija from the western town of Kitale's Kenya Medical Training Institute, KMTC. George Natembeya, the governor of the region, declared that he was fascinated by the sensational moments. He added, "Good work, Elizabeth. Dedication in service delivery is our guiding principle." The governor then had the opportunity to meet with Elizabeth Robai Lukalija on Tuesday evening in his office to express his gratitude for the dedicated nurse who works with zeal and passion.
I'm nurse by profession, but the county reproductive health coordinator.
Oh, okay. Yeah. That's how you nurse young one, isn't it? That's what you do every day.
Yes, I enjoy dancing, so it's in.
Hospital waiting lists in England hit record highs. According to official figures released on Thursday, the number of people in England's state-run healthcare system who are currently waiting for treatment has surpassed 7.1 million for the first time ever. The National Health Service is reporting lengthy wait times for routine and emergency care as well as tests, including cancer tests, as it struggles to clear pandemic-related backlogs. At the end of September, there were 7.1 million people on the hospital waiting list, the highest number recorded since records began in August 2007. This number increased by 100,000. With a nursing strike expected to add to the wintertime pressure brought on by an increase in seasonal viruses like the flu, the situation doesn't appear to be getting any better anytime soon.
More than 3 million U.S. middle and high school students reported using tobacco in 2022. Researchers from the U.S. Food and Drug Administration and the U.S. Centers for Disease Control and Prevention recently released a study that found that more than 3 million middle and high school students in the U.S., or 11% of those students, reported using tobacco currently in 2022. E-cigarettes, followed by cigars, cigarettes, and smokeless tobacco, were the most popular tobacco product among youth for the 9th year in a row. About 2.55 million reported using them. The report, which was released on Thursday, stated that youth use of tobacco products, in any form, is unsafe. Such products contain nicotine, which is highly addictive, and can harm the developing adolescent brain. Using nicotine during adolescence might also increase risk for future addiction to other drugs.
Mindfulness works just as well as medication to curb anxiety, study finds. A new study suggests that a mindfulness meditation course may be just as effective at lowering anxiety as a typical medication. In the study, which was released on November 9 in JAMA Psychiatry, 276 adults with untreated anxiety disorders participated. Escitalopram, the generic version of the brand-name drug Lexapro, which is frequently prescribed to treat anxiety and depression, was given at random to half of the participants in doses of 10 to 20 milligrams. The other half of the participants were assigned to an 8-week mindfulness-based stress reduction course. The outcomes were astounding. Over the course of the 8 weeks, anxiety symptoms decreased in both groups by about 20%.
Experimental therapy gantenerumab fails to slow or improve Alzheimer's memory loss in clinical trials. An experimental drug called gantenerumab did not work for people who had early-stage Alzheimer's disease or were at high risk for memory loss, according to the maker on Monday. The drug gantenerumab belongs to a group of injected medicines used to clear the brain of beta amyloid, which is a group of sticky protein fragments. Alzheimer's disease is characterized by beta amyloid buildup. While the majority of these medications have cleared beta amyloid as intended, many have failed to show any real-world benefits to patients. Their brain function and memory don't significantly improve despite treatment.
Sperm count declining worldwide, study. A significant new study released on Tuesday found that the global sperm count of men is declining quickly after having decreased by half over the previous 40 years. The study urged intervention to halt the decline. Israeli epidemiologist Haggai Levine's study, which has been criticized for only including data from North America, Europe, Australia, and New Zealand in 2017, has been updated. The new study is the largest meta-analysis on the topic, containing information from more than 57,000 men gathered from 223 studies in 53 countries. It confirmed the 2017 finding that sperm counts have decreased by half over the past 40 years with the addition of the new countries. Furthermore, data suggests that this worldwide decline is continuing in the 21st century at an accelerated pace, said the study published in the journal Human Reproduction Update. According to the study, sperm counts are declining at a rate of about 1.1% per year. To stop further disruption of male reproductive health, more action and research are urgently required, it was added.
Leprosy bacteria able to regenerate organs study. Researchers at the University of Edinburgh believe that leprosy bacteria may hold the key to safely repairing and regenerating the body. The remarkable capacity of the bacteria to almost double the size of livers by promoting healthy growth has been discovered through animal experiments. By doing so, the bacteria have more tissue to infect, which is a sneakily selfish act. But the scientists say that figuring out how they do it could result in brand new age-defying treatments. When leprosy infects the skin, eyes, and nerves, it results in disability. Throughout time, those who were infected were avoided. However, the bacterium that causes it, Mycobacterium leprae, has other peculiar characteristics that fascinate scientists, such as the capacity to engage in biological alchemy, changing one type of bodily tissue into another.
WHO recommends skin-to-skin care for preterm babies. For preterm infants, the World Health Organization advises kangaroo care, also known as skin-to-skin contact. The new WHO recommendation represents a significant departure from earlier advice and accepted clinical practice. It also reflects the enormous health advantages of ensuring that mothers and their preterm babies remain together after delivery, according to WHO. The new recommendations are intended to increase survival and health outcomes for infants who are born before 37 weeks of pregnancy, or who are less than 2.5 kilograms at birth, according to the Global Health Agency. Due to their lack of body fat, Preterm infants frequently struggle to regulate their body temperature when they are born and frequently need medical assistance breathing.
Game-changing type 1 diabetes drug approved in US. Regulators in the USA have approved an immunotherapy drug that has been shown to delay the onset of type 1 diabetes. Teplizumab, according to experts, ushers in a new era in medicine by attacking the disease's underlying causes rather than just its symptoms. It functions by restructuring the immune system to stop attacking insulin-producing pancreatic cells inadvertently. It will probably open the door for approval decisions in other nations. Around 8.7 million people worldwide have type 1 diabetes.
Over 1 billion youth risk hearing loss from headphones, loud music, study. A thorough review of an available research on Wednesday estimated that approximately 1 billion young people worldwide may be at risk for hearing loss due to using headphones or going to loud music venues. The World Health Organization-led study urged governments and manufacturers to take more action to safeguard future hearing, and urged young people to be more cautious about their listening habits. More than 19,000 participants aged between 12 and 34 were included in 33 studies that were published in English, Spanish, French, and Russian over the past 20 years. The analysis, which was published in the journal BMJ Global Health, examined data from these studies. It was discovered that 24% of young people engaged in risky listening habits when using headphones with gadgets like smartphones. Additionally, it was discovered that 48% of people had experienced unsafe noise levels at nightclubs or concert venues. According to the study's analysis of these results, between 670,000 and 1.35 billion young people may be at risk of hearing loss.
Arsenal and England's Bukayo Saka pays for 120 children to have life-changing operations. In a remarkable act of kindness, Bukayo Saka paid for 120 Nigerian kids to receive life-changing surgeries. The 21-year-old Arsenal winger, who led the Gunners to the top of the Premier League standings, is gearing up to play a significant role for England at the World Cup. However, the fan-favorite kid has made time to assist children in Nigeria, from where his parents immigrated to the UK, who needed major operations. Saka teamed up with the charity Big Shoe, which has the support of celebrities like Paul Pogba, Mesut Ozil, and Philip Lahm, to help kids in Kano, Nigeria's second-largest city.
Poor nutrition can cause physical, mental decline in elderly, nutritionists. Elderly people must consume the right nutrients from their meals, according to nutrition experts, who have warned that malnutrition increases the risk of physical and mental decline in older adults. The nutritionists explained that one of the main causes of elderly people's frequent health complications is poor diet. Poor diet in elderly people may cause weight loss, confusion, dizziness, altered brain functions, and loss of appetite, according to experts. They added that other health risks that poor diet poses for the elderly include weakened immune systems, decreased energy, and chronic illnesses like type 2 diabetes, high blood pressure, heart disease, stroke, and osteoporosis.
Parents welcome twins from embryos frozen 30 years ago. According to the National Embryo Donation Center, Lydia and Timothy Ridgway were born on October 31st from what may be the longest frozen embryos to ever result in a live birth. Molly Gibson, who was born in 2020 from an embryo that had been frozen for nearly 27 years, held the previous record. Molly stole the record from her sister Emma, who was created from a 24-year-old frozen embryo. Although the U.S. Centers for Disease Control and Prevention track success rates and data regarding reproductive technologies, they do not track how long embryos have been frozen. So it's possible that an older frozen embryo was used. However, there is no proof that a live birth from an older embryo has ever occurred. The embryos were created for an anonymous married couple using in vitro fertilization. The husband was in his early 50s, and they used a 34-year-old egg donor. The embryos were frozen on April 22, 1992. They were preserved for nearly 3 decades on tiny straws in liquid nitrogen, at a temperature of almost 200 degrees below zero, in a container resembling a propane tank. The embryos were kept at a fertility lab on the West Coast until 2007, when the couple who created them donated the embryos to the National Embryo Donation Center in Knoxville, Tennessee, in the hopes that they might be used by another couple. That couple was Philip Ridgway and his wife.
Bride stung by one of world's most venomous fish on honeymoon from hell. A couple went through their honeymoon from hell when the new bride was told incorrectly that she did not need to take precautions, and was subsequently stung by one of the world's most venomous fish and rushed to the hospital. Amy Thompson, 27, and Callum Thompson, 37, a newlywed couple, have now opened up about their nightmare before revealing that Amy is still not fully recovered after almost 2 months. Disaster struck while the couple was out snorkeling during their 2-week honeymoon in the idyllic Mauritius in September. Amy remembered being told there was nothing dangerous in the waters below, so she wouldn't need to put on her sea shoes. Amy followed the advice and decided to cool off in the water without shoes, but much to her surprise, she got stung. The 27-year-old recalled feeling extremely ill for the remainder of the trip, after what turned out to be a poisonous sting from a stonefish, one of the most venomous fish in the world. The hairdresser claimed that after an additional hour on the trip, she felt the most intense pain of her life and had to go to the hotel doctor. She was then transported to the hospital, where she spent the night. However, Amy from Lymington, Hampshire, is still looking for a treatment for her pain 8 weeks after the incident.
779 million Africans lack sanitation services, WHO. The World Health Organization Regional Director for Africa, Dr. Matshidiso Moeti, has said that 779 million people in Africa lack basic sanitation services. In commemoration of World Toilet Day in 2022, which has the theme Sanitation and Groundwater, Dr. Moeti made this announcement in a press release, highlighting how the sanitation crisis has an effect on groundwater. Every year on November 19th, the WTD is observed. According to her, access to safely managed drinking water, sanitation services, and good hygiene practices are essential for preserving the public's health. It helps achieve the SDG 6 targets, and is crucial to achieving all other SDGs for sustainable development.
Baby given 1 day to live reaches first birthday. Doctors predicted that Marie Claire Tully's son, Hector, would likely only have a day to live when he was born prematurely at just 23 weeks. His mother was instructed to say her goodbyes because there was very little chance he would live. Hector, however, defied the odds, and today marks the first birthday of Marie Claire's miracle baby. Although the past year has not been easy, his mother claimed it to be the happiest year of her life. He was born with severe complications because of his prematurity, and has since spent 259 nights in the hospital. He has hydrocephalus, which means spinal fluid cannot flow around the body, due to a bleed on his brain. He also has chronic lung disease, retinopathy, a feeding tube and centralized sleep apnea.
Girl, 7, hailed a hero after diving into pool to rescue toddler from drowning. A toddler was saved from drowning by a 7-year-old girl after the toddler fell into a public pool. While on vacation with her parents in Broome, Western Australia's far northwest, Year 2 student Phoebe Van Neal from Perth saw the toddler inadvertently fall into the pool. The young girl was commended for her quick decision-making, because she jumped into the pool without any hesitation, before anyone else realized the toddler was in trouble. Although there were many people in the pool, Phoebe was able to reach the child, lift her out of the water, and make her way back out of the pool, just as others realized the child was in trouble. The toddler was upset, shaken, and crying as she was pulled to safety, but she is reportedly fine after the incident. Phoebe talked about how important learning to swim is. She took years of swimming lessons at a pool in South Perth, leading her to become confident around water, which is something her mother couldn't recommend enough. Phoebe has now says she wants to be a surf lifesaver when she grows up.
Pregnancy soon after miscarriage, no more risky. Study. Contrary to popular belief, getting pregnant shortly after having an abortion or miscarriage does not seem to pose additional risks to both the mother and the unborn child, according to researchers who have recently examined real-life data. The World Health Organization, WHO, suggests a gap of at least 6 months. This will give the woman some time to heal. However, a study in PLOS Medicine that examined 72,000 conceptions suggests that couples might safely try sooner for a baby. In other words, if there are no medical complications, women who feel ready to try again right away after a miscarriage should do so. Pregnancy spacing is the subject of ongoing research, according to the WHO, which will help inform any future revisions to the recommendation.
8 glasses of water a day may be too much. According to recent research, the daily recommended 8 glasses of water may be excessive. Researchers from the University of Aberdeen found that the recommended daily intake of 2 liters of water was frequently excessive for most people. People only really need about 1.5 to 1.8 liters of water per day, according to scientists, because about half of what we consume daily comes from food. For your daily global health news, visit www.staywellworld.org. Please do well to subscribe, like, share and comment. If you've already subscribed, turn on the notification icon, so you don't miss any update. Thank you for watching.